Hello, I'm Dr. Sha-Rhonda Green. I'm a licensed clinical social worker, therapist, social worker, and therapist, licensed clinical social worker since 2004. I am passionate about helping Black women heal. I want to share with you today about 20 red flags for you to assess to know whether the therapist you are looking for is a good fit, is a good match. If you're new to therapy, this is going to help you to weed out some of those things and keep yourself safe. And if you are already in therapy, and are embracing your journey, this is a way for you to reevaluate, to be mindful of how do you keep yourself safe in therapy, and then also just to make sure that you continue to make good choices for yourself, because this is your journey and you deserve to be seen, heard, and to feel safe. Number one, lack of licensure or certification. If your therapist's license has lapsed, if they do not have a license and they're saying that they're practicing and at one time or even at no time they were a therapist, that is unethical. It's malpractice. Please make sure that you go to your state's website and Google the therapist and Google that information inside there. If your therapist is on an insurance panel, that likely has been vetted, because you cannot be unlicensed and receiving insurance. If you are a self-pay client and you are receiving some therapy from someone that says that they're a therapist, if they don't have licensure or certification, that is unethical. It is like driving a vehicle down the interstate without a driver's license. You are operating a machine that has a lot of ability and power to damage. In the same way with your emotions, with your mental health, with the intimacy of what you're going to be sharing, no one should be having that and not having a license or whatever to help to guide you through your process. Number two, unprofessional behavior or communication. If they're not calling you by the name that you asked to be called, if they're being disrespectful, if they're spending more of their time in session talking about how they hate their supervisor, how they hate their coworkers, if they're not being responsive to your emails in a timely and professional manner according to what their guidelines are about communication within the session. If does not feel clear and you are asking questions and it's not being clarified, that your therapist does not have the ability to help you to get that information in ways that feels honorable, that is the second red flag. Number three, unclear or misleading information about the practice. So in terms of professional ethics and code of conduct, you can't say that you're an expert in something that you have no training in. You can't say, hey, I'm a brain surgeon and you're really maybe a podiatrist, or you might just make waffles. You can't do that. It's unethical. Number four, a disregard for boundaries or confidentiality. So if someone is violating your physical, emotional boundaries, your space boundaries, if things are making you feel uncomfortable, you're feeling encroached upon in some type of way, and you have that is a red flag. Confidentiality. So what you talk about in therapy is confidential. The only time that confidentiality does not apply is if you're saying, hey, I am suicidal, I am homicidal, there's child abuse or maltreatment that is happening, there's elder abuse that is happening, if there's an adult that is in dependent care that is being abused. In those instances, as a mandated reporter, an individual that is a licensed therapist, a licensed practitioner, a medical provider is a mandated reporter. In those instances, we have to make a report. Number five, an overemphasis on specific techniques or approaches. This may indicate that a therapist may not be adept at including some eclectic ways, and also being able to be resilient in their therapy practice to help you in the ways that a therapy approach or intervention might be more beneficial to you. There are some therapy techniques and interventions that work for certain populations and may not be working for you. So if a person is being really rigid and saying, oh, this is the only therapy approach that I know, this is the only intervention that I'm going to use, it's akin to trying to fit a square into a circle hole. And that may be a reason to say, hey, this is not working. The therapy that you're giving me, your approach is not helping me to feel better or to get to meet my goals. Number 6, lack of cultural competence or sensitivity. If you are in the therapist, as the client, if you're sitting there attempting to re-explain things to a person, re-explain your cultural identity, your ethnicity, about how you are experiencing racism, or how you're experiencing bias, how you are experiencing gender discrimination, if you're feeling like you're defending how to for someone to understand you, and your therapist is not being sensitive to the nuances of how you as an individual have to navigate the world, whether it is a certain ability, whether it is a way that you process information, whether it is some type of processing issue like on the spectrum. If that therapist is not being sensitive to that and wanting to kind of understand that, and also getting training as therapists. I'm going to talk about my profession, LCSWs. We have to have 35 hours of continuing education every 2 years for licensure renewal. And that includes ethics, that includes cultural sensitivity and competence, and it also includes CEUs, continuing education units, on areas that we may have interest in, so that we can continue to stay sharp, so that we can be aware of what's going on, that we can have understand terms like inclusivity, equity, that we can understand concepts like intersectionality, and how those things affect vulnerable populations and marginalized populations. Number 7, unwillingness to answer questions or provide information. If you have the right to make an informed decision about your therapy, about how you want to be treated. And if your questions aren't being answered and you feel like you're not getting the information so that you can make an informed decision, then that is a red flag. Number 8, pushy or aggressive marketing tactics. Like, I don't know if you heard the term butts in seats. Like, oh, you got to get here, you got to get here, you got to do this. And feeling like you're pressured to make some type of decision, or you're pressured to choose a particular person. You have the right to take your time to make the best decision for your life. Number 9, unprepared for sessions. If the therapist is feeling flustered, they're coming in there late, they're eating their breakfast while on the Zoom call with you, they're doing stuff and they're putting on lotion. They're talking about, oh, well, I didn't check your insurance, and they're trying to check your insurance while you're at your therapy session. If they're taking up your therapy hour to hold on one second, let me go do this, let me go fill up my water cup, or not being prepared. This is your therapy hour. Like, you ready to talk about the things that's important to you. Like, your therapist, things happen, right? To have compassion. But this is a professional environment, whether you are virtually or whether you are face to face. You want to be heard and you want to be seen. So it's really important to hone in on that. Judgmental attitude. If your therapist is saying, well, why did you do that? I don't even understand that. If they're like in their tone, in their demeanor, we are listening to what you are saying, and we are looking at the incongruence of what you are saying. But there's a way to do that does not further erase you, that does not minimize or mute your voice. So if you're feeling like that this person is judging, and you know how, and they're doing all these different things with their face that make you feel unheard and unseen, that is a red flag. And number 11, unresponsive to messages. That goes back to communication. So if they're being unresponsive to your messages, and you don't understand the timeline about when those messages are returned, that is a red flag. Number 12, uncomfortable office environment. If there's noise, if there's a sound issue, if what you are seeing in that therapist's office, that there's things that are displayed that make you feel uncomfortable, and it feels graphic and it feels uneasy. There are a lot of technologies that allow therapists to kind of blur their background. Those things, like things that may be distracting or uncomfortable in the office environment, whether that's digitally or face to face. Let's see. Number 13, fails to provide clear guidance. So there should be a clear path about your treatment, about how this therapy is going to work, what are the outcomes, the potential outcomes. Number 14 has unrealistic expectations. Number 15 uses jargon without explanation. Number 17 dismisses your feelings. Number 18, overemphasis on medication. There are a plethora of ways to treat you holistically, and if you feel like you're being pressured, then that is a red flag. It is your choice. And number 19, doesn't provide progress updates. So whether that's bi-weekly, whether that's monthly, whether there are outcome measures for depression, for anxiety, whatever the issue is that you're being treated for, there should be some type of progress, because therapy is not meant to be forever. Not to say that, oh gosh, like if you have to come back to therapy at another time, it just means that you come back for another time to continue to work on some things. But there's a term called therapy dependence, when you attribute your success only to your therapist and you are not able to go out into the world and apply the things that you have learned in therapy. So it's important to give progress updates. And number 20, displays unprofessional physical or emotional behavior. In therapy, it's unethical to have dual relationships, that you should not have any type of romantic, blurred line relationship with your client. Like, not ever. Because there's a power differential. The therapist is the person that is a power differential. You are coming into therapy to be emotionally vulnerable, to be emotionally naked. And the therapist is in a position of power with the credentials, with all of this stuff, and there's a differential there. And so there's a differential for abuse, for exploitation. They shouldn't be doing that. It's unethical. So those are the 20 red flags to look for as you're navigating, and for you to watch for, to protect yourself and find a therapist who truly supports you and advocates for your well-being. Take care.